expose them to below the rib cage, right? After all, lumbar spine did not start until we pass the rib cage, right? You can expose this one up to X1. That's okay, all right? We have dealt with how to locate the vertebral spine, so you should know how to do that. So this is iliac crest. My hands come like that. This is the junction of L4, L5. This is L4. If I want to gain flexion between L4 and L5, I'm going to push what? L4, like that. How do you push? You see the spinous process of the lumbar spine. Can you show the spinous process of the lumbar spine again? Very wide. Push it either, the spinous process, yeah, that one. You captured it?
Yes.
You can see how large it is. You can't push it with a thumb. You can't push it easily with a thumb like this. Your thumb will get tired in no time. You need to use a better part of your hand. You see the underside, oh yeah, the underside of the arm, the little bone here is called pisiform. That's the side we are going to use to push because it's wide. The spinous process is wide for lumbar spine. So we've got L4, L5. You now get that pisiform on the spinous process. This is the hand I will do the work. Can you take this down a little bit for me, Red one on live? Down, it's okay. Then you can lock this hand with this one for reinforcement, and you get a straight elbow. Is that clear? Then you go. I can bet how he's relaxed now. He wasn't relaxed before. That is it. Cpam. It's on the spinous process. You can do it. It depends on your strength. You can go for 3 minutes. You stop. Reassess flexion. If the patient is able to do more flexion with less pain, you can repeat this procedure 2 more times. If you do it and you give patient more pain, then stop it. It's not good for that patient. Do you understand? We've done the Cpam. We're done. Now, what do we have to do? The UPA. Don't worry, Flourish. Wait. I'll show the UPA slide when we get there. Now, again, that's L4. We're looking for the facet joint now. You remember what I told you in my last class? Facet joint is about a thumb breadth away from the spinous process. This is the spinous process. If me and Kumar are having the same hand span, his facet joint should be here. I will just go a little bit down. Now look, this is what I will do now. I'm not using my pisiform again. I can use my thumb. You can either do this or you do this. I prefer this because I know with this, I will capture the facet joint. So I will just go. Are you sleeping, Umar? Seriously? Do you get it? Thumbs is good for the facet joint. This is good for the lumbar spinous process because it's huge. In the cervical, we use this for everything. Do you remember? Are we good? Yeah. So if you want to gain flexion, you do Cpam at the center, UPA on the right, UPA on the left. In the exam, if I tell you this patient has problem of flexion between L4 L5, carry out your manual therapy to help him. If you do only Cpam, you score 3/10. Yes, because if you do this one, that's another 3, this one, that's another 3. Extra 1 mark is for me.